Hello, hello. Welcome, welcome, welcome. My name is Sayron Leary. I am one of the health educators at North Carolina A&T State University, and I will be your moderator for this evening. I'd like to take this opportunity to thank you all for coming and being a part of the Your Life Matters COVID-19 Vaccine Education and Awareness Panel for parents and students. At this time, I am going to introduce our panelists for this evening. First, we have our Executive Director, Dr. Padanda Webb. We have our Health and Wellness Coordinator, Dr. Yolanda Nicholson, as well as our Pharmacy Manager, Mr. Lehman Mitchell. So before we begin this evening, we just have a couple housekeeping things that we want to make sure that we get out the way. So first, only our panelists and the moderator, which is myself, will be able to be seen and heard this evening due to it being a webinar. That being said, as we go through the presentation, please make sure that you are putting any and all questions you may have down in the Q&A section, which should be located at the bottom of your screen. At the end of the presentation, we will then circle back around and try to answer as many of you all's questions as we can in the allotted time. So now I would like to pass it to Ms. Dr. Nicholson.
Thanks so much, Sayron. I appreciate the introduction. All right, if we'll go to that next slide, please. Unfortunately, we need to be reminded sometimes about why we're even doing this to begin with. And that entails some of this data that's right here in front of us. Worldwide, we faced 175 million cases. In the United States, right now, we've faced over 600,000 deaths. And those numbers are startling. So that's why we're here and that's why we want to talk, because we don't want to add to these numbers. Next slide, please. So in our state, in North Carolina, we've had over 1 million positive cases confirmed. When you look at the graph on the left here, you see that 56% of our current cases in North Carolina are within the ages of 15 to 49. The only dilemma we have is when you look at the vaccination by age in North Carolina, the graph on the right, and you see that only out of that 56%, only 39% of those folks are being vaccinated. So the people that are the most affected are the least likely to get vaccinated. Considering that we already have over 4 million people vaccinated, fully vaccinated, whether you got the 1 dose or the 2, those numbers need to get better. Right now, we have ages 20 to 25 with the rates going the highest. So we need to do something different. Next slide, please. So our vaccine safety. Right now, when we look at how we've gotten to this point and how the vaccines were developed and how they've gotten here, during the trials, over 110,000 people participated in 3 different vaccine research trials with no significant safety concerns. At Cone alone, they had 85,000 total vaccines to the public they've administered, and over 143 million were fully vaccinated in the United States, and it was done safely. So right now we want to go ahead and let Dr. Webb go to the next slide.
Good evening, everybody, and thanks for your time. My goal is to talk about vaccine efficacy today. I want you to know that the vaccines are safe. You get about 94-95% efficacy with the Moderna and the Pfizer vaccine, so they are highly recommended, as well as the Johnson & Johnson. You get really good efficacy with that vaccine as well. That's the one-shot deal, 72% effective for those that may not want to take more than 1 injection. One of the things that I've been preaching this whole time is making sure that you trust the science. You have got to trust the science. I know that there's been a lot of controversy kind of surrounding vaccines and that sort of thing, but I want to assert to you today that the vaccines are safe. They have been studied long before COVID-19 was out. The reason why it appeared that the vaccine was created quickly is because there was a lot of data already that existed over the past decades. We had more resources that we were able to pour into getting a vaccine, and we knew that there was a pandemic. This was literally killing people. So we had to react fast. We had to use the research that we already had to make sure that we could protect our population. So I want to make sure that you walk away from here knowing that this is not brand new. This is not, some science experiment. It has been studied for years. And again, it's been proven to be highly efficacious against COVID-19. Next slide, please. Side effects. So when it comes to side effects, nothing is without potential side effects, and it doesn't mean that you'll necessarily have any of these. However, there are some soreness at the injection site is probably the most common side effect that we hear, followed by fatigue, headaches, muscle pains, fever, chills, that sort of thing. But it's nothing that will last you no more than about 24 hours. So it certainly is worth having potential side effects versus getting COVID itself and potentially landing in the ICU. Next slide, please. So I am going to turn it over to our pharmacy manager, Lehman Mitchell, to kind of discuss some of the vaccine myths. Lehman.
Okay, thank you. First of all, we know a lot of myths about the vaccine out there. One common myth is that young people don't need to get vaccinated because they're immune. Anyone can experience severe cases of COVID-19 with devastating outcomes. Another myth is that it's seen to have long-term damage in young people. This also isn't true. It can be a long road to recover. There's such a situation called long haulers disease, which is fatigue, shortness of breath, persistent loss of smell. Also have trouble concentrating, muscle aches, depression, and anxiety that can last. And about half of the children that get the disease have it lasting for greater than 123 to 4 months out. You still have side effects. Also, too, there's inflammatory condition in children, which is where your heart, your lungs, your gastrointestinal, in young kids. Next slide. Okay, myth number 3 is that the COVID-19 vaccine can cause infertility. This truth is also not proven to be effective. There's no evidence to suggest late pregnancy or breastfeeding it can be effective. Also, too, the vaccine has not shown any effect on getting pregnant or being pregnant. So you can be conceiving a baby without a problem. 4 is that you get COVID-19 from the vaccine. The 19 is not a live vaccine, so you're not going to get any signs or symptoms of COVID-19. The reaction you have is your immune response to your body developing antibodies to fight the disease. And also about 1/3 of hospitalized children that get COVID-19 end up having to go to the ICU for some kind of intensive care treatment. Next slide. As you can see here, a whole litany of different kind of myths that are out there on the web. They say that the vaccine has a microchip in it, which isn't true. It's not, government isn't tracking you with the vaccine. You have a phone, you have credit cards, you're being tracked that way also too. So there's no microchip in the vaccine. People also say that the vaccine can cause a viral shedding, meaning you get a dose and you get everybody else. That too is not true. It's not a live vaccine, so you're not going to have any kind of viral vaccine or any components of the vaccine. Another myth that's out there is that this vaccine has fetal cells in it. That's not true. There are no fetal cells inside the vaccine. A lot of things that you hear online, they can be kind of fact checked by going through other resources. And a good resource to have is the cdc.gov or even medline.gov to kind of check the sources and make sure you're getting accurate information. Next slide.
So we are excited to partner with Cone Health for an event tomorrow. If you have young people in your house, 12 years or older, or if you yourself have not been vaccinated, I encourage you and invite you to come out to Dudley High School tomorrow. We will be there tomorrow serving food, we'll have music, have t-shirts for those that decide to get vaccinated. It's going to be a really, really exciting event. And I want to welcome everyone out to come and get vaccinated at Dudley High School tomorrow, 11 a.m. to 6 p.m. Next slide.
Thank you, Dr. Webb, and I will definitely be there myself. I know you said you got food. Okay, cool. And for those of y'all, glad to hear it. And for those of y'all that may have some previously scheduled engagements and are unable to make the vaccine clinic tomorrow, don't worry, there are other opportunities available to you all. Simply visit conehealth.com/vaccines for up-to-date locations, or the event section on our Cone Health Facebook page for the community mobile clinics. This presentation that you all have just witnessed will also be sent out to you all, so that way you will have these reminders whenever you might need them in the future. So at this time, let's open up for questions and answers.
Thank you, Sayron. Hi, everyone. I'm James Harris from the Marketing Department at Cone Health, and I'll be monitoring the chat. So, Sayron, in the meantime, while we're looking out for questions, I'm going to pull some questions from our fact sheet and position them to the panel for discussion. So these are really in no particular order, but we'll just use these as a foundation for a discussion now. To the panel, there's a theory that we can achieve herd immunity by letting the virus spread within the community. What is your response to that?
My response is, I think it's kind of risky. To attain herd immunity, a lot of people are going to have to, unfortunately, get the disease and have serious consequences. So I think the risk of trying to achieve herd immunity is too costly.
Thank you.
Especially
and Dr. Webb, were you going to add something?
I was just going to say we would certainly lose some people while we're attempting to do that.
Yes, indeed. Yes, indeed. And how about this one? Is it okay to only get the first dose of the vaccine? So, of course, we're talking about Pfizer and Moderna, which are the vaccine versions that you need to receive 2 doses. So to the panel, is it okay to just get the first dose of one of those, and will you be okay then?
Well, the only dilemma with that is that you wouldn't get the full effect of the vaccine. Of course, for Johnson & Johnson, yes, 1 dose, you're good to go. However, with Moderna and Pfizer, you would not get the efficacy. And the goal here, of course, is to prevent the 100% mortality rate, which is what you'll get with 2 doses from Pfizer and the 2 doses from Moderna. So that's what we're going for. We're trying really hard to make sure that we don't lose any more folks. We don't want to add to any more of these data sheets that we get all the time.
Absolutely. Does anyone else have anything to add to that particular question? Okay, so we'll move on to this is an interesting one. So the question asks, and I'm going to riff on it a little bit for our discussion. Why do we still have to wear masks, and do masks really work?
So what we know before we had the vaccine is that the mask, it was that layer of protection that we had along with social distancing and hand washing. So we do know that masks work. The other part of this is we are going to achieve great efficacy with the vaccines, 95%, 94% with Pfizer and Moderna, 72% with Johnson & Johnson. But there is still the potential to contract the virus. It may not be, you may not contract the virus and end up in the ICU, which is what we don't want to happen and why it's certainly worthwhile getting it. But you still are not 100% protected against getting the virus. So we certainly still recommend minimizing your risk. So If you are not wearing a mask and you've been vaccinated, I would recommend that you are doing that around other vaccinated individuals, or you're doing that outdoors.
And in the space of masks, there's another type of face covering that there seems to be a lot of kind of pros and cons, that it's not really understood by everyone whether or not these are okay. So when it comes to face gaiters and the integrated neck coverings that they call face gaiters, what is you all's perspective on those? Are those safe, and are they as safe as masks, or are they less safe?
They don't seem to be as safe because that layer of the material that it's made out of is only a one layer piece, whereas a lot of our masks, even some of the ones that we have that are reusable, come in with at least two, and even have the option to put in a filter. Not only are we helping to prevent COVID, but we also saw a decreased rate in flu and colds and strep. All those cases were down. You go to any medical practice, they'll confirm that all of that was down because we were wearing those masks. But those in particular, the neck gaiters, are not as effective as some of the other face coverings.
Thank you. And Dr. Nicholson, you just mentioned the flu. Could you all talk to us about the comparison of the flu vaccine to these COVID-19 vaccines in terms of efficacy specifically?
So what we know about the flu, and I'm not sure specifically where we're going with this particular question, but I can tell you that the COVID-19 vaccine, we know, that it works, and it works pretty well. Sometimes, with the influenza vaccine, depending on, that efficacy can be a little bit less than that. And we may have a good flu season, we may have a bad flu season. So they certainly aren't comparable, but certainly recommend still getting the influenza vaccine as well. I mean, you want to protect yourself as much as you possibly can from illness. So not poo-pooing the influenza vaccine by no means. We certainly still want to make sure that we're pushing that vaccine, and you're getting that in the fall.
Right. So, and where that question was going is, it's been read that could you confirm that the efficacy of the flu vaccine is truly typically around mid 60%? Typically no higher than 70%, whereas the Johnson & Johnson COVID-19 vaccine efficacy is in the mid 70s, and the Pfizer and Moderna is in the mid upper 90% in terms of efficacy. So for those who are less trusting of the COVID-19 vaccine and more familiar with the flu vaccine, these COVID-19 vaccines have a higher efficacy than the flu vaccine, as the data shares with us right now. So that's where that question was going.
Okay.
Yes, they do.
Okay. Could we talk about fertility? That seems to be a very common question that folks tend to want to double down on. So could you talk about the question that we'll ask is, will the COVID-19 vaccine affect fertility, pregnancy, and breastfeeding moms?
No, right now, all the indications are that it wouldn't. It had no effect on that. All three of those things, pregnancy, breastfeeding, fertilization, as far as trying to get pregnant or conceive, has been proven to be safe and effective. Matter of fact, you can have worse outcomes if you do catch COVID if you're pregnant.
Okay.
I certainly want to make sure that we point out that the COVID-19 vaccine is recommended in pregnancy, and you pass those antibodies on to your unborn baby. So you would be not only protecting yourself, but protecting your baby as well.
Thank you. Another question that we have, as we learn more and more about the three vaccines that are available, and we leverage the information that's out there, is, will we need to get booster shots, say at some time in the future, for those who have received the vaccine? What can our panel tell us about the potential of a need for booster shots in the future?
Right now, it's kind of early to know for sure, because you got to remember the vaccines hasn't been out there for a full year yet. So as time goes on, they'll assess whether the antibody titers are still high and you have adequate coverage, or you got to get a booster shot, whether it's a year later, yearly thing like the flu vaccine, or, every 5 years or every 10 years, or one and done. That hasn't come on with time.
Okay, thank you. And could we talk about the different age segments? So we know that we were giving the vaccines to those 65 and older earlier. And so now we're giving them to those age 12 and older. Can you talk about any conversation on the effects of the vaccine on our younger population, especially the 12 to 18-year-old population? As a parent, what should the parents be concerned with that they haven't thought of?
Well, I'll speak to that, considering my 14-year-old just got her second dose today. So I'm excited about that for her. But she did extremely well. And I think teenagers in general have been doing really, really well getting the vaccine. May see some fatigue, that sort of thing, but in general, they are doing well. And certainly recommend vaccinating everyone 12 and up.
Thank you, Dr. Webb. So we want everyone to hear in your words that we want to make sure that those 12 and up absolutely do receive their vaccine, because the risk of receiving of having COVID is still significantly greater than the side effects of receiving the vaccine. And
absolutely.
Would all of our panelists agree with that thinking?
Yes.
Okay. Thank you very much. Thank you all. So you guys have addressed the microchip earlier, and I really appreciate the comment about the cell phones. I just took a trip, and as I walked past a particular venue, my phone buzzed and said, "Hey, you're passing Starbucks. Would you like to have some coffee now?" So to your point, there are other things that are going on that do keep track of where we're going. And as our folks from our scientific community here on our panel have said to us, that is not an aspect of the vaccines that truly does exist. So just want to make sure that our audience does hear that from these distinguished experts here. I'll open it up to the panel. This will be sort of just a kind of rapid fire here. Are there any things that you guys have heard personally? What's been the most entertaining myth that you've heard, or the one that made you just scratch your head the most? Has there been anything that you've really heard that really just struck you, that you wanted to say, hey, no, folks, this is not the case?
The most interesting one I've heard is that you become a magnet afterwards. As someone that has been vaccinated for several months, I've not stuck to any refrigerators or items in my home or at work. But it was interesting to hear of that potential, that I'm now magnetic.
And you know what, Dr. Nicholson, someone actually shared that one with me as well. And they insisted that that there was copper in the person's shoulder, and they put a magnet on their shoulder and it stuck there. And it was only on the arm that received the vaccine. And I mean, they were convicted that was the case. So I appreciate you confirming that scientifically that's not possible. So thank you for sharing that. What about you, Brother Sayron? What's been the most interesting you've heard, maybe at the barbershop or out in the community somewhere?
Pretty much, yeah. I think you guys have pretty much covered it. The microchip one is definitely a common denominator. And similar to the cell phone aspect, I mean, you've got a cell phone, you got a social security, you share your location with literally everybody on all of your social media accounts. I mean, if somebody really wanted to track you, you gave them everything when you wake up in the morning. So, yeah, that's pretty much the one that I kind of hear quite regularly.
Okay. Brother Mitchell, what about yourself?
I pretty much heard mostly all of them, but one interesting aspect that I did hear recently was from a patient that had gotten a shingles vaccine and refused to get the COVID vaccine, and their logic was, I've had shingles before, I don't want to get it again. So I simply would say singles hasn't been known to cause the kind of fatalities that COVID has. And if you can use that logic and wait until you get COVID with the new variants that are out here and it being more aggressive, more transmissible, leading to more severe cases and disease, you might not have the opportunity to get the COVID vaccine after you've gotten it. So if you use that logic, I don't think that you want to, it may pan out for you. You may have thought about it, and in the end, he decided he was going to go ahead and get the shot. So it's not something that you want to wait until after you've had it, because you might have the opportunity to get it afterwards.
Yes, can appreciate that. And Dr. Webb, what about you? What's been the most interesting myth that you've heard related to the COVID-19 virus?
So I had an opportunity to review some survey data, and on the survey, one of the participants said that it was the mark of the beast, right? So they related it back to, something religious. And so I can tell you that if it was the mark of the beast, I would not have it. But that is out there and it's circulating. So
yes, that is probably the best one that I've heard. Wow, I think you definitely win the championship for the most interesting myth that you've heard. So we don't have any other questions that have come into the chat. So we'll go ahead and begin to wrap it up. But I'd like to ask the panel, as you've had your vaccines, what is the one thing you're most looking forward to doing now that you have had your vaccine that you haven't been able to do since we've all been in quarantine? And Dr. Nicholson, I'll ask you to lead us off, please.
So the thing that I think I'm looking forward the most is this summer I'll be getting my nieces and they'll be spending a few weeks with me. And I haven't had a chance to do that because of what I do at work. I didn't want to put them at risk before the vaccine was available because we are encountering folks that we have to give a diagnosis to that, sometimes makes you uncomfortable, but you still have to do your job. But I wanted to spend time with family. And so having them be able to come and visit and stay with me is one of the things that I'm most excited about, just to have everybody together again.
Yes, indeed. And how about yourself, Sayron?
Well, being that A&T is my alma mater, I
better
am
not
very
take
much
my
looking forward to.
answer.
Oh, for sure, homecoming. Definitely. It is a national holiday. So, we were unable to do that last year. So I'm definitely looking forward to connecting with some old friends this year.
I love that answer. And Dr. Webb knows that I have a favorite homecoming that I attend as well. It's in a different part of the Mid-Atlantic region, but I love you all as well.
It's irrelevant.
Be nice. What about yourself, Dr. Webb?
Since Sayron took my answer, I would say that is my number one, but seriously, I love to host cookouts and gatherings, especially during the summer. So just having people over to be able to, have a cookout and relax and just kind of chill. I like those things I certainly miss. So looking forward to that. 4th of July is coming.
Yes, indeed. And Brother Mitchell, what about you? Bring us home.
Yeah, for me, I'm looking forward to getting together with the family, go to visit my parents. I haven't seen them in a long time. And because my dad said I couldn't come unless I had a COVID vaccination. So I got that out of the way.
Right.
And also to jazz concerts and stuff in the summertime, attend festivals, and now I can get a chance to do that.
Absolutely. And to my colleague Jill McAllister, I'd love to hear from you as well in terms of what you're most looking forward to.
We just have made travel plan after travel plan after travel plan. We are not a family that likes to sit still, especially not my husband and my daughter. And so we are just going to be going and going and going. We've got trips planned from here all the way through December. One of which is to Universal Studios, which we were supposed to go to last summer. And I made my daughter promise that she would still be crazy about Harry Potter. So awesome. We could go this summer. And I even gave in, even though I hate to fly, and I booked flights and everything so we don't have to drive. So our whole family is fully vaccinated. We are hitting the road.
That's awesome. I just got back from a trip. I have an annual trip to Las Vegas with some of my college teammates, and I just got back yesterday. So that was great to be able to do that with my friends. We normally do it in March. We actually postponed the trip so that everyone could get vaccinated, and there's 6 of us total coming from all different parts of the country. So that was great to travel with friends, and now of course I look forward to doing the same with my own family as well. So to the panel, is there anything else that you'd like to share with the audience that you have not stated up until this point before we close and adjourn?
The only thing I would say is if you are someone who is straddling the fence on whether to get the vaccine or not, I would encourage you to come to Dudley High School and come talk to me tomorrow. You know, I'd be glad to try to lay any fears or any concerns to rest if it makes you feel better if you are straddling the fence about whether to get the vaccine or not. So come see me tomorrow at Dudley High School, 11 a.m. to 6 p.m.
Thank you, Dr. Webb. And I think that's the perfect way to close out. And just 2 other points that I'll share with everyone before we close is that, again, if you have any questions about the COVID-19 vaccine, you can visit conehealth.com/vaccine. And if you would like to see this or other town halls that we have hosted in the virtual space, you can go to conehealth.com/vaccine town halls, and you will be able to observe other content just like this, and also review the vaccine myth fact sheet that we have published to help folks understand what is actually fact and myth when it comes to the COVID-19 vaccine. And with that, we'll go ahead and close out. Jill, do you have anything to add before we close out?
No, I'm good. And we will also be emailing out that vaccine myth sheet and the presentation that we did to those who are attending tonight.
Okay. Thank you, everyone. Have a great evening. Bye-bye.